If you are someone 40 years or older, here are 5 simple things you can do to impact your health positively and prevent insulin resistance. If you don't know what insulin resistance is, please watch my previous video for more information. Number 1, eating smart. Eating smart meaning cutting down on carbohydrates, avoiding processed sugars. I saw a video earlier today and someone was sharing their weight loss journey and listed all the things that they cut down on or stopped eating altogether. And another person commented, it was so funny. They were like, so what did you eat? They didn't say what they ate. They only listed things that they did not eat in their weight loss journey. I thought that was funny. But a lot of times you see out there, people tell you to stop eating X, Y, Z. It's really an individualized plan when it comes to a health journey because people have allergies, people have food intolerances and sensitivities. So what works for me might not necessarily work for you, but we know for sure there are certain foods or there are certain processed foods that can increase one's risk of certain illnesses. And high consumption of carbohydrate as well as processed sugars is a key risk factor to insulin resistance. So cutting down on that and avoiding it can go a long way to improve your health. You don't have to automatically stop eating everything that you've been eating for 40 years, right? But you can cut down on how much you eat. Another way to look at it is instead of stopping any food group, you can just add healthy options. When the healthy options keep you filled up, you will have less chances of eating more of the unhealthy options. So adding healthy options to your food choices and maybe eating those first before the things you might be craving for. So for example, if you plan to eat rice for lunch, maybe you should eat your veggies first and your fruits and then save the rice for later. You might not have room for it or you may end up eating less. Number 2 is moving your body daily. A lot of people think because they are up and about, maybe working 1 or 2 jobs, going from one job to another, running around, taking care of the kids, taking care of the household, that is enough for exercise. So in addition to everything else that you do, if you're someone who do not routinely exercise or intentionally exercise, try adding an exercise routine or setting time aside for you to do something intentional, like a sustained movement for about 20 to 30 minutes, at least 4 to 5 times a week. In addition to strength training, it is recommended that doing things such as lifting weights and stuff like that, any type of strength training helps to build your muscle and keeps you stronger over time. A lot of times when people talk about losing weight, they refer to weighing less on the scale. But the key is really not losing your muscles. Make that a key factor at least once or twice a week. Throw in some weights. It doesn't have to be at the gym. It can be anything around the house that you can lift and a weight that you can tolerate. I was listening to a podcast and this health professional shared that a lot of times when people get older, the one thing that causes debilitation is the loss of muscle strength in their legs. So walking helps to build your leg muscles. Doing that every day can go a long way. It doesn't have to be in a gym, as I said. It could just be a walk around the block or dancing or doing something you like that keeps you moving for about 20 minutes. Number 3 is sleep and stress. So if you're able to manage your stress level and be able to get about 7 to 9 hours of sleep every night, then that reduces your risk of a lot of chronic conditions, particularly when it comes to heart disease and respiratory conditions. So sleep helps your body rejuvenate, helps your body recover. I know we all don't have time, and sometimes we're just doom scrolling instead of winding down to sleep. but getting a good night rest can help boost your immunity and help you in so many ways to prevent chronic conditions, including insulin resistance. Number 4 is incorporating healthier habits when it comes to fluid consumption. So usually we recommend you drink 8 glasses of water a day, but if you're someone who drinks sodas, you drink other types of soft drinks such as tea, coffee, you may not be able to drink up to 8 glasses of water a day because that might be too much fluid for you. But when possible, drink more water than anything else. Cut down on alcoholic beverages and avoid cigarette smoking altogether. These all contribute in preventing insulin resistance. Before we get to number 5, please like this video, leave a comment, share, and follow this page. Number 5 is the most important. Regular checkups. Having routine annual visits with your primary care provider can help you know your numbers so you can know how to manage your health appropriately. So going in and checking for doing blood work to check for your cholesterol level, your average blood sugar level, your blood pressure, stuff like that can help detect chronic conditions early. So stuff like high cholesterol and so on and so forth, they all contribute to insulin resistance. So having a regular checkup every year. Most of us have health insurance and we don't use it. Yes, most of us. We pay for it every month and we get a free annual visit with our doctor without any copay, yet we don't use it. So if there's one thing you learn from this video, or there's one thing I emphasize today, is for you to get your checkup. We are in September of 2025. If you have not had your checkup yet, please, tomorrow is Monday, go ahead, call your doctor and make that appointment. If you do not yet have a doctor, go online and look for a doctor near you, schedule a new patient appointment and go in for your annual visit. Usually those appointments are scheduled way out, so now is the best time to do it in time before the year runs out. You already paid for the insurance. Go ahead and use it. Remember that prevention is powerful. It can save you years of health issues down the line. So starting today with small steps, go for checkups, manage your dietary intake, stay active. Keep a smile on your face, show kindness to others out there, and let's continue to help ourselves prevent insulin resistance. Thank you for watching. Let me know in the comment section what topics you would like me to talk about, and let's continue this conversation together.